Hi, I'm Dr. Rothkopf, and I'd like to speak to you about narrow-angle, closed-angle glaucoma. Unlike other glaucomas, this is sort of a misnomer because really there's nothing wrong with your eye. Your eye is not sick. It's just that your eye is anatomically smaller than a normal eye, and as a result, everything inside the eye is sort of scrunched together, and it makes a high risk of your iris, the colored portion of your eye, actually closing off the drainage system, thereby not allowing fluid to leave the eye. If that should happen, this becomes an ocular emergency because the pressure goes sky high, and that can actually strangulate the nerve in the back of the eye in anywhere from 6 to 24 hours. So, as you can see, it's important that this is recognized and treated, because if you get into such an attack, you can become irreversibly blind in a very short amount of time. Okay, so let's explain a little bit what's going on here. Usually in people who are farsighted, those are people who are usually wearing magnifying glasses in order to be able to see things up close. Their vision is better for distance than it is up close. Their eyes are smaller than a normal eye. And whereas we always say good things come in small packages, this is one of the cases where that's not true, because everything in your eye now has to be packaged into a smaller area. So if we can look over here at this chart, we can see that when I'm doing the examination, what gives rise to a suspicion that you have this condition is that when I shine the slit lamp light onto your eye, the light falls on your iris right behind the cornea. The iris seems to bulge forward and actually touch the cornea. I then confirm my suspicions by putting on a special contact lens which allows me to look across the eye almost like a periscope, so I can actually look at the drainage system of the eye. The normal drainage system of the eye appears like a pigmented line at the junction of the iris and the cornea. However, in people who have shallow chambers or narrow angles, their iris bulges forward and blocks access to that drainage system. When we look at this chart, we can get a little bit more magnified view of what's going on. In the normal eye, fluid is produced behind the pupil, comes around through the pupil, and exits through the trabecular meshwork, which is the juncture between the iris and the cornea. In people who have narrow angle, and especially people in their 40s and 50s who start to develop some cataract, cataract is not just a discoloration of the lens, but if you can see, if you look closely, you'll be able to see that there are layers to the lens, to the cataract, sort of like a tree. As it gets older, lays down more and more rings. And part of what happens as you get older is that your lens becomes bigger and bigger and takes up more room in this already crowded, smaller eye. As a result, the iris touches to the lens, and the fluid which is produced behind the pupil pushes the iris forward so that it bulges forward sort of like a sail in the wind of a sailboat, and totally closes off the angle. As you see, we cannot see any trabecular meshwork here, whereas over here you can. The treatment for this narrow angle condition is to put a laser iridotomy, making a small microscopic hole with a laser. This takes about 2 to 5 seconds to perform. It is painless, and it will do nothing in terms of changing your vision. This is not a vision corrective laser. It's just something that will anatomically change the eye, so that here again, where I shine the light and I can see the iris sitting right behind it, over here, where a hole has been put into the iris, an iridotomy has been put into the iris, you can see that the light beam is quite a distance from the iris as the iris fell backward. And so that what happens in this case, if I put a small iridotomy through the iris that's bulging forward, the iris then is allowed to fall back and open up the drainage angle. Once this is done, it is near impossible for you to ever have a narrow angle glaucoma attack. This then prevents any kind of ocular emergency due to this. However, this does not protect you from possibly developing open-angle glaucoma, which is the normal kind of glaucoma that you hear most of your friends and neighbors and families have, for which they use drops to control the pressure. If you should have this condition, we would be recommending that you have this laser iridotomy, not because you have glaucoma, but because we want to prevent this ocular emergency, which is a potentially blinding situation. Thank you.